Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Today we're talking with Dr. Natalie Bessom, a board-certified family medicine physician at Hamilton Primary Care in Dalton. Dr. Bessom, thank you for joining us today.
Thanks. Glad to be here.
So in today's episode, we're going to unpack some of the myths that are around low-carb and high-protein diets, because, you've always heard people say that carbs are the enemy, or you have to eat more protein to lose that fat. But honestly, I don't really think it's that simple, is it?
I absolutely agree. Carbs are not the enemy here.
So if we can start with the low-carb movement, whether it's keto, paleo, or more like clean eating diets, why are we so afraid of carbs?
Well, I think over time they've snuck themselves into foods or drinks that you wouldn't normally find them. So our parents' generation or grandparents' generation probably didn't have all the complex health information and different foods, processed or fast food and things like this, that use a lot of carbs to make them tasty. So most people think of carbs as like sugar. And that's true. Sugar is a carb. But the other half of that is that fiber is a carb. And I think we all know and have heard that fiber is a healthy thing. It does prevent colon cancer. It can keep you full longer. It helps your digestive patterns. So just think about the simple empty carbs, like the white things, the rice, the bread, the potatoes, alcohol, sugar, white sugar. And then there's that other half, which is the complex carbs, the good carbs that give you the fiber, like fruits, vegetables, whole grains, beans, for example. We have a lot of foods that you wouldn't inherently say, oh, that's a bad food. But if you look at the carbs on there, wow, they're a lot, because fiber's under that list too. The fiber and sugar are the two headers underneath a carb label.
So definitely cutting carbs is not the answer to this.
It can be beneficial for short-term weight loss. So, if you're getting married next week or something like that and you just need 5 pounds off, I'm not saying that's a healthy way to lose weight, but certainly you'll get results initially by cutting them out because they're everywhere. We eat and drink a lot of them, and most of the times they get stored. But if you want a good lifestyle change and consistent weight loss, pick the carbs that have the higher fiber content and look at the labels. Whole grains and things can sometimes be a marketing slogan. If you see that on the cereal box for Cinnamon Toast Crunch, okay, those are probably not all whole grain carbs, right? But, there are plenty of fruits and vegetables that we need to be eating to give our brain glucose and be able to fuel our day that are not bad ones. And if you're diabetic, you can even watch your sugar meter and notice that the blood sugar does not rise after certain carbs that are what I would call healthful carbs.
Oh, yeah. Because people almost entirely, they will just ignore the fiber part.
Exactly. So fiber, the whole grains, the complexity of the carbs have a lot to do with how it's processed in your body. Mm-hmm. Essentially, there's two pathways getting into the physiology of it. If you have an overload of the bad carbs, or really any food, fat, protein, for example, it will go straight to the liver in the portal system that is the detoxifying pathway. So it never really goes through the gut to get absorbed, because your body doesn't recognize any true nutrients in it. But if you have the complexity and the fiber, then those nutrients will go through the small intestine instead and not get stored. They'll get absorbed.
It also feels like everything is moving to be very protein heavy, because protein just sounds like, oh, I need more protein.
I feel like they even add protein in foods that you wouldn't add protein, like pancakes. And, I'm laughing about it because I think this is all marketing. There is it's a similarity between health and protein for some reason, but that's certainly not always the case. Protein is a dense food. It carries a lot of calories, to be honest. So a lot of times when people are on a weight loss journey, you can do yourself a disservice by eating more protein because it is definitely more calorie dense. And if you're watching ins and outs, intake versus output of calories, you will find that the protein is putting a lot more calories on your plate at every meal. So I really encourage people to look at the protein. Don't go for things that are protein heavy, but in general, your day should be more like 45 to 50 grams if you're a woman, maybe 55 grams if you're a male. And that should be your limit. If you have any more than that, it's probably just more calories that you added to your pancakes, for example, that you didn't eat.
Yeah, it's definitely something where like I'm never like actively paying attention to how much I am consuming in protein. And so, in the past year, I've been a little more health conscious. I've been losing weight. And now that I have been looking at that stuff, I'll see one that's like 40 grams. I don't even know if it can go that
Yes,
high.
absolutely.
But it's like, what in the world?
There's like chocolate milk now that has 40 grams of protein. That's your entire day in one product.
Seriously.
Normally it doesn't taste that good in my experience, but and if you've seen me in person or been my patient, you know that I lead a healthy lifestyle. I try to act through role modeling, and my kids eat the same way. But I didn't always do that. I learned a lot of these things in medical school. And when you really go into the physiology of your body and what is fact and how we process things, you gain a lot of insight. So, when I was in college before medical school training for a marathon, I did the high protein stuff and I gained weight. And I was like, how is this possible? I think I blamed it on muscle mass, which was not the case at all. But, you fall into these traps, and I don't want anyone to be stalled with their weight loss progress when they're really trying because they just were going off of marketing and fake things, myths.
I completely agree. And this is a random thing I'm going to say. I'm not an expert on this stuff. You literally are. But I found that like I've lost weight legitimately when I've just, kept up with my calories and then like drank water.
Absolutely. It's so simple. I know it's easier said than done. I don't want to make it overly simple, but fruits, vegetables, nuts, beans. I promise you, if you do that and drink water, you can even indulge yourself on those foods like until you're full, and you will not gain an ounce. Those foods are healthful for you. They're used by your body as fuel, and so none of it gets stored. So, you have to be careful with the marketing stuff. I don't want to say that everything that tastes good is bad for you, because that would, defeat the purpose of living, right? But a lot of the things that taste like they're too good to be true, to be a diet food, they are. And a lot of times that's because salt has been added too. It has no calories, but it has a lot of flavor. And so I see also a mistake with the dieting stuff is that people go with these granola bars or like shakes or whatever from a diet company, and they just load it up with artificial sugar and salt to make it taste okay. But the calories don't go up, but that complexity, it just goes down with all those fillers and artificial things.
I'd rather have more calories with genuine ingredients than this kind of filler stuff.
Yeah, absolutely. And it tastes so much better. If you've grown a garden or had a farmer's market tomato, it's just so different when you get it from a good local place, and there's a lot of flavor in it. So definitely I would encourage people this summer to go out and look for farmers markets and look for fresh produce that's local, because it tastes so much better. And you can be happy about what you're eating again, even if it is healthy.
That's a fantastic idea, and supporting local markets.
Absolutely.
There's always a point where like you don't need to overdo it. And is it possible to truly overdo it?
You can. I think everything you can overdo. So, I love watermelon, but I'm not going to eat a whole watermelon in one sitting. That's probably way too much sugar for any one person, even if there is fiber in it. So generally the guidelines I use, and you don't need a calculator or math or anything to do this, counting calories. But if you put a standard plate or bowl, every meal, if you can make it half fruits and vegetables, and then the other 2/4, like, smaller than the size of your fist, the carbs or protein, you will lose weight. Fruits and vegetables are very low calorie, but high complexity. So you can eat a lot of them and they keep you full. But, the calories are not there to make you gain the weight.
Talking about a balanced plate. We've always been taught in a way, but not like really shown.
Yeah.
Like truly how you would do that.
But if you really want the simplest answer, fruits and vegetables, half your plate at every meal, even breakfast. And you can go ahead and make the protein source or the carb source for a little variety as less than your fist. And that should make you lose weight.
And there's just like carbs from whole foods can come with fiber, water, and those nutrients. And it's not just all calories, right?
Absolutely. Yes. The more complex, the more fiber, the more color in it generally is a good rule that you can have a lot more of it than a regular food.
Do you see where patients can get caught in this like weird cycle of going between so many diets and just it's really doing more harm than good?
Yes. And it's so discouraging. If you've ever been on that cycle of yo-yoing, you try one thing for a couple weeks and you get tired of it. Or you don't see results maybe. So you switch to something else. I promise you, if you can be consistent and, if we're talking about, I hate the word diet, but if you really want a diet per se to follow, the Mediterranean diet has had the most health research for good outcomes, both short-term and long-term for health goals, but it can reduce dementia, heart disease, diabetics can reverse, a lot of different things, blood pressure, fatty liver disease, by just eating a lot more fruits and vegetables, beans, nuts, and really being low on your meat intake, very occasional on your refined foods or processed fast foods, that kind of thing. Those should not be an everyday thing. That is so dangerous to get into. And I feel like that's our society. It's not necessarily that you know that that's healthy or think that it's healthy, but we get caught up in convenience. And some of those are the worst foods for you. So please limit them.
I was at a point where I was having fast food a lot. And it was, yeah. It was like almost every day, and I was almost excusing myself. Oh, it's not that bad, or I'll just have, one or whatever. And my weight was, skyrocketing in a sense. And when I'll be honest, I hit 200 pounds, and I thought like, oh my gosh, I need to.
You had that self-check instinct come in.
It's definitely being willing to do it long term, because I knew that it wouldn't be fast, and I've stuck to exercising. And no, I don't like accurately check every calorie I eat. I just keep like a mental note, like, okay, I've already had this much. Maybe I eat like cereal or something. Yes. And that's great that you have the self-check mechanism. Yeah. I feel like, and it's easy to get caught up into it, especially if you have kids that you're bussing around. We have activities after school, like work's busy, you're working late. But how easy is it to pack a peanut butter and jelly or like a handful of trail mix or something for in between practices? You don't have to stop at the drive-thru. You're influencing your kids and what they're going to eat the rest of their lives by making habits for convenience food. And, quite frankly, if you're in my office and trying to treat your chronic diseases, it's not a way that you want your kids to live. So stopping it when they're young is a great point, and I'm glad you brought that up. The convenience stuff is really, really hard to latch onto when you have kids. It's that idea where, like, the kid wants like some fast food, and they say, oh, we have something at home. That can be annoying, but that is so good to follow.
But how did they know there was fast food? Like you opened their eyes up to it on a regular basis, and that's what they ask for. And, a lot of families tell me like, oh, they won't eat anything but chicken nuggets, or they won't eat anything but, my husband used to eat tortellini with ranch dressing on it. That's a true statement. But it's because you let them have it too often. We have to take some onus as a parent too, that our kids have to be eating healthy, and we have to enforce that, because we're the ones that bring the food and make the food in the house. But if they see you eating certain ways or drinking certain things, they're going to want that. And that's hard if you're influencing them and you're telling them, no, you can't have it, but I can. Yes, you're the parent. You get to make those choices, but it's hard to tell them that it's not healthy and then you do it right in front of them.
I heard very simple advice like years ago that I still think about and like try to practice it as much as I can, where they say like, if you just don't have it in the house, then you're not going to eat it.
I love that.
Like, you just don't.
Oh, I love that. And you're not spending money on something that's sabotaging your health.
Yeah.
And I know it's so easy to go through the aisles, whether you're looking at the marketing and the packaging and it says it's healthy, or if you're just hungry and you just want to indulge. But especially with the advent of the online ordering and groceries that you just pick online, don't fall victim. Only put those things in your cart that you know are good for you, and you can save so much money and so much on your healthcare costs in the long term.
Yeah, food should make you feel better. It shouldn't be stressing you out.
Absolutely. I hate when people stress about food, and that's not a way to live. We should be enjoying food, not stressing about it, or guilt is a big one I see after you eat something, and that is not a natural behavior. So if you're feeling that way, talk to your doctor, get on a weight loss program that's healthful, because that is not the way your brain should be operating.
This has kind of hit close to home for me, and I just really appreciate all the stuff that you've been telling us. It is like really helpful advice.
I'm glad to do it. I love this. I love telling people about it. Again, I didn't always eat or show the lifestyle this way, and it's only through education that I learned about it and can do it. And so I really want to get the word out that it does work, and it makes you feel the best you've ever felt in your whole life if you could just stick with it and promise that there are results for you.
If you are in need of a primary care provider, you can make an appointment with Dr. Bessom at Hamilton Primary Care at 706-226-9355. Dr. Natalie Bessom is a board-certified family medicine physician, and Hamilton Primary Care is a family practice, which means that they can treat your whole family. Call 706-226-9355 to make an appointment, or visit vitruvianhealth.com/primary for more information.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.